with Jake Bostrom. He is a comprehensive ophthalmologist at Palmetto Eye and Laser Center in South Carolina. Thank you, Jake.
My privilege. Thanks for having me.
So we wanted to hear from someone that's in private practice and has found their own way of making global health work for them in their jobs and in their lifestyle. So tell us what kind of work you do and how often you've been able to do that.
Yes, so internationally, I've had a couple different opportunities. I've been to the DR several times, been to China a couple times, but more recently I've built a relationship with the organization in Eswatini, formerly known as Swaziland, a group called the Luke Commission. And so for the last 5 or 6 years, that's been my connection overseas and the group I've been working with. Year to year, it's looked like 1 or 2 weeks of service over there. Primarily surgical. We see a lot of clinical patients as well, but the heart of what we do is surgical care.
And is that 1 or 2 weeks combined, or you do 2 different trips in a year?
I found it practically easier for me to only be gone from my practice for a week. I've got great partners who support and help me while I'm gone, but being gone for 2 weeks is a sort of plan in anticipation and deal with on the backside of things.
Right, I would imagine. So what led you to kind of pursuing this kind of work and finding these opportunities?
I actually grew up, my parents were missionaries in Brazil, and so I kind of saw what medicine could look like in the third world because of their involvement. My dad wasn't a physician, but he was a pilot, so he would fly doctors to small rural areas that didn't have physicians. And so even as a young child, I saw kind of the opportunity of what medicine could provide. I think ophthalmology is uniquely positioned because we can do surgery in pretty remote situations with what we would call an operating room, but a general surgeon may not see it quite the same way. We don't need anesthesia. We don't need the need for blood transfusions or the kind of equipment we need, and the ability to do surgery can be done in pretty basic circumstances.
It's very true. So how, once you finished your training, you started getting into practice, how did you find those opportunities? How did you find that first trip or that first organization and create that space to be able to leave your practice to do this?
Sure. I think that was probably the biggest challenge. I had the desire, but sort of logistics of making it happen. I think if you talk to anybody who's doing international ophthalmology, manual small incision cataract surgery is just the best option. Given the severity of the cataracts, sort of the cost considerations in doing them, it's just a better surgery for these patients. Most of them are, 2,200 or worse cataracts that even with my operating room set up in the third world aren't ideal cataracts to phaco without causing significant corneal edema. So I think the first step is really getting comfortable with manual small incision cataract surgery. And I think that's a big hurdle, concern, maybe even a fear for many surgeons. And so for me, great surgeon from Seattle, Van Siapko, was willing to take me on a trip with him to the Dominican Republic. And it was one of those see one, do one, teach one experiences. He did several cases as I observed, then he kind of monitored me as I was doing them. And in that situation, we had 2 little tiny ORs literally side by side. And so as I started operating independently, he was 10 feet away. And so I'd call him, Dan, come over here, take a look. What do I do next? And that kind of sort of hands-on shepherding training really worked really, really well. And we did a week of that. And at the end of the week, I was proficient or competent in the sense that I could do the surgery myself, probably not proficient in the sense that I was doing them in a time-effective manner. And that's just come with more and more experience. Wet labs, and I had done all the models. I think as we all know as surgeons, nothing feels quite the same like actually doing the case on a human eye. I think it's important to practice. I think it's important to do those wet labs, but the real experience comes from actually doing the cases yourself. And that's only in a real world situation, which is pretty difficult to replicate in the States just because we see so few patients that we can, appropriately decide to do manual small incision cataract surgery on.
So it sounds like you would recommend someone that's interested in getting involved to find opportunities to get involved with M6 and learn that procedure. What else would you advise somebody to look into? What kind of organizations should they get involved with, and how do they go about finding them?
Sure. I think one of the hard pieces of the puzzle is you really need an in-country organization that you can really work with. I think circumstances have changed, and probably appropriately so. 30 or 40 years ago, you could go with a passport and good intentions and a microscope and just start operating. I think what we found over the years is that the best care happens with the relationships that come from in-country relationships, folks who are there all the time, who can see these patients preoperatively, who can help assist in post-operative care. And that only comes from a relationship. And so really finding that robust organization that is able to have the networks, not only to find the patients who need care, but also to follow back up with them, to help them. I think that really is the most important piece of the puzzle. And that can often be trial and error. Some organizations are more strategically structured to be able to support that, and others are not. The organization I'm working with right now, the Loop Commission, is just so remarkable in their organization, in their structure, in the way that they keep records, and their ability to follow up patients. So we've got data, probably 4,000 or 5,000 cataract patients, because they've been so good at documentation, not just at the time of surgery, but in follow-up as well. And I think that's absolutely empirical. That empirical evidence is critical to the process of giving good care, that we don't just go with good intentions, but we're coming back with good results. We can analyze and evaluate what we've done and then adjust accordingly, not to how we feel, but what the
Right.
data show.
Yeah, I agree. I think that's a key thing to note when looking to work abroad with organizations, and something many of us have learned just through the years, that it's not enough just to show up and go. You need to have more of a local presence as well, or the group you work with.
Exactly. And to be clear, that's come for me with trial and error, not because I knew that on the front end, but I've seen ways that it doesn't work as well. And you realize that that's just such a critical piece of the process.
Right.
It's also critical for efficiency as well. I mean, I'm doing in Africa probably literally 10 times more cases in a week. Now, it's not because of me, although I've gotten more proficient. It's because of the organization. It's because of what they do. They're pre-oping patients. They're doing the biometry for us. They're assisting with the patient transport and movement and all those steps. So I get the opportunity to operate, and they take care of all the logistics. If you're doing it solo, you're not giving as good a care, and it's just next to impossible to really do any significant volume because you have to do every single step.
Any advice to somebody looking to get involved on where to look for that first opportunity, how to get connected with someone, or picking a location, where to go?
Yeah, I think probably location would matter in the sense of you want a position where it's relatively comfortable in an operating room with a good microscope and probably some temperature control. After you've done this for a while, I think the newness of the experience is easier to handle some of the other variables. One of my mentors in residency used to always say, don't change more than one variable in the operating room. If you go overseas, you're changing 25. And so finding those aspects that you can control to some extent, I think is really important in the learning process. And as that proficiency develops, you got a little more flexibility to handle some of the more unexpected. For me, I think is a real important step. This is a surgery that is a lot more challenging than it would seem initially, and there's some pitfalls and challenges that are hard to explain or plan for without actually being there and doing it. So having someone to help you bail out, having someone to walk you through those things is a real important first step. And I think all surgical skill is transferable. So I think any competent cataract surgeon can learn M6, but it needs that shepherding environment where someone's really serving as a mentor and you're serving as an apprentice to learn the procedure.
Great. I think it's great advice. And then my last question is just any tips or pearls for travel, for being prepared, things to pack, anything that you've just learned through experience?
Yeah, I think the first step is if you think you need it, you better bring it with you. Whether that's, Vision Blue, which nearly all of these cases need, whether it's, medicines that you may need in a pinch. I think planning for the opportunity to arise that something you may need that you can't get. I think it's any international travel, you bring extra medicines that you may personally need or anticipate those sort of unexpecteds. If you're prepared for them, you may not need it, but that kind of preparation is important. And again, going with someone who's been before can really help you walk through that and anticipate those things that are often sometimes difficult to think about if you haven't done it before.
Mm-hmm. Great. Well, thank you very much. I think that our listeners will be very happy to hear from, different ways. There's so many different ways to get involved in global ophthalmology and global health. And what you've been able to accomplish is just fantastic. So thank you very much for joining us.
Thank you, Jacquelyn. Thanks for your time.